Numbers from the county are serious, but only tell part of the story.
People are tired. People are really struggling, and they are determined to take care of people. So we have both. We're part of your front line, but we're also sort of the last line.
The first line of defense sometimes includes the last person a patient sees. To give you some more perspective on what those numbers mean for workers on that front line, ABC 10 News reporter Jared Aarons had in-depth conversations with doctors in hospitals all around the county. And they say hospitals and the people working in them are being pushed to the breaking point.
I spoke with 3 doctors from 3 different hospitals who say it's a mix of despair and hope as the vaccine arrives the same week that the numbers surge. I'll let them explain it in their own words.
We know that this is actually a really difficult time right now because our hospitals are getting quite full and staff is getting really stretched.
The issue with COVID-19 is that the length of stay is quite long. So when these people get to the ICU, they're there for a while.
As you go into the hospital and you go from room to room, it's more COVID patients.
Infection rates are followed by hospitalizations, are followed by deaths. Unfortunately, with this pandemic, we've seen it over and over again.
We're seeing a lot more in the emergency room. They're getting a little sicker. A lot of it started after Thanksgiving.
A lot of those cases that I see are a lot of people who are now wearing their masks or having these parties or birthday parties or holiday parties.
I had a female patient who had a history of breast cancer. The story was that she had to see her family on Thanksgiving, travel by plane to see her relatives in Sacramento, and then came back and started getting sick.
And it affects the patient care for everyone. It's not just COVID patients, right? It's if you get in a car accident or you have a heart condition.
So things like time-sensitive or routine surgeries, we tend to delay those.
Even for sort of the best of us who do this on a regular basis, we're sort of in a sort of disaster mode, if you will.
Our health system will flex. Our health system will do everything we can to increase our capacity and take really good care of people. So I want to tell people that. At the same time, there's a limit to what each healthcare system can do.
I think a lot of physicians are tired. A lot of healthcare workers are tired, but we're here. We're ready to help.
The biggest thing is just to worry about today, protect ourselves, don't let our guard down.
I've seen some of my colleagues on social media, around the country showing themselves getting the vaccines, and I'm surprised by how emotional it makes me because I know they're protected.
We've run such a good marathon so far. Let's finish it off strong.
I think people realize there's a light at the end of the tunnel.
It's getting brighter. It's a tiny light, but we're getting there. We're getting there.
Doctors say now that there is a vaccine, they need all of our help. Just a few more months of wearing masks, socially distancing, washing our hands, and we can beat this disease. Jared Aarons, ABC 10 News.